Hello everyone, my name is Stephen Lewis, and for the second aspect of our clinical application project, we have prepared a PowerPoint presentation for student exposure resources for COVID-19, In this presentation, we will be covering we will define an exposure, talk about what to do if you were exposed with the appropriate personnel, and also ways to take care of yourself to prevent coming in contact with COVID-19. Ultimately, this giving you more success for this year-long program. Next slide. So defining an exposure. So we have close contact, and essentially close contact means that you are face-to-face with someone in a close proximity with a person who has COVID-19 for 15 minutes or longer without a mask. And so we provided two examples for you, and the target audience is TTU ABSN student, and so this could be applied to any one of us in the program. And say that you have a roommate or family member who returns from a music festival where masks were not required, and they return showing symptoms of coughing, headache, and fever with a fever greater than 101 degrees. And then you decide to sit down and visit and catch up, but you were sitting there talking to your roommate without a mask, and they presented these symptoms. And then a few days later, they end up testing positive for COVID-19. That's an exposure because you talked with someone in close proximity without a mask and they had COVID. And the second one, your roommate awakens with the feeling of a fever, and then they come to your room and they ask you to use your thermometer. You give it to them, and you also continue to interact with them while they have COVID-19 symptoms. Not thinking that they have COVID, a couple of days later, they test positive for it again because they had COVID and you were around them without a mask. And so those are two examples of what it means to be exposed to COVID, and that defines an exposure.
Hi everyone, this is Salma, and here are the actions that you can take to protect yourself and others. Getting fully vaccinated, receive the booster within 6 months after the second primary dose, wear a mask in large crowds and close contact settings if you're not vaccinated, wear appropriate PPE when caring for clients, avoid poorly ventilated areas, perform hand hygiene upon returning to your home, maintain healthy and nutritious eating habits, practice getting good sleep. Preventing the spread of COVID-19. Hand hygiene is actually the most effective for preventing and controlling the chance of infection. Here are some 5 moments for hand hygiene obtained from the World Health Organization. We recommend hand hygiene before touching a patient, before clean aseptic procedure, after body fluid exposure risk, after touching a patient, and after touching patient surroundings.
My name is Sarah McDaniel, and today I'm going to be talking about resources for exposure to COVID-19. The exposure policy per the Office of Institutional Health at Texas Tech Health Science Center states that when a student is exposed, they need to inform their supervisor or course instructor or program director, and complete the online attestation form and follow additional guidance from the TTU HSC Office of Institutional Health before resuming on-campus activities. Institutional Health will advise on the appropriate follow-up needed, including but not limited to the need for testing, self-isolation requirements, and or advising to contact their healthcare provider. The TTU HSC Office of Institutional Health, a contact there is Shayla Ford, the head nurse, and her phone number and email are listed below. The references that we used for this PowerPoint presentation is the Centers for Disease Control and Prevention, the TTU HSC SAFE website, our Potter and Perry Fundamentals of Nursing textbook, and the World Health Organization.